Good afternoon, everyone. To begin with, I would like to give a quick introduction about myself, my colleague Maud Gorza, and our department. So I am Linda Lasbeur. I am an epidemiologist, and my colleague Maud Gorza, she is a demograph. We have been working at Santé Publique France for 15 years. We are currently in charge for the prevention and health promotion for babies, parents, and future parents. In past, we both worked on health inequalities, so we have a special interest about this issue. Now we are in charge of scientific projects such as studies or evaluation of interventions in which these inequalities continue to be taken into account. We are happy to be here with you today. And the objective of today's presentation is to discuss the setting up working seminar on public health about child maltreatment and epidemiological studies. We will do this presentation in two voices with Maud. So, before we move on our presentation, just a few words about what has been done on this subject in our agency until the seminar. Considering the burden of maltreatment, we support the exploitation of non-maltreatment specific surveillance system, update of child homicide days according to days certificate, and validation with Catherine Quentin teams of an algorithm for identify children under 5 hospitalized as results of abuse with PMSC data. In 2019, Maud and I have coordinated a series of articles on child maltreatment and its consequences in Santé Publique France Epidemiological Review. I have put the reference on the slide. On primary prevention work, we create a website, the first 1,000 days. It's a site aimed at parents and parents-to-be, offering content on children's fundamental needs and support for parents in their role as parents, like attachment, responsive caregiving, ordinary educational violence, etc. We have an intervention, PANJO, is a home-based early prevention intervention focusing on the development of secure attachment between babies and their parents. During the COVID-19 lockdown, we observed warning about the increase of child maltreatment in families. The subject of child maltreatment was put at the agenda, and following this period, we asked ourselves, what was the role of the French Public Health Agency on the development on public health surveillance of child maltreatment? How and why did you want to organize a seminar? The observation today is that child maltreatment is not sufficiently taken into account in the field of public health. Child maltreatment is now known as a global problem with serious lifelong consequences, but it is still not treated as a major public health issue. Indeed, child maltreatment epidemiology is poorly developed in France. You heard a research team yesterday and today, but there are few working on the subject. We know little about the prevalence, the type of maltreatment, and determinants of child maltreatment in France. And to develop this knowledge and the comprehension of what are the difficulties faced by research teams when they work on it, it is for us a prerequisite before considering the development of surveillance. Thus, a first step for us was to understand what makes the development of this public health research so complicated. This seminar had two main objectives: make an initial assessment of epidemiological studies, type available in France today and those missing, identify both the main obstacles and the levers that would facilitate the implementation of epidemiological studies. To answer this question, we set up a workshop with the support of a scientific organization committee. You can see in the first column, the composition of this committee was composed of learner society, French institutions, and researchers. This committee worked on the program, and we organized a two-day seminar. The first day was dedicated to sharing experience based on the different types of past and current researches, national retroactive survey, surveys based on medical records, national administrative database on admissions to hospitals, following of children in care, with focus on difficulties and solutions found or not. The second day goes more specifically on regulatory and ethical issues, with crossed viewpoints between legal, research, and ethics point of view. This was a work seminar with large time dedicated to discuss technical questions with the audience. We decided that it would be a face-to-face event on invitation. The audience has been selected with the committee and completed with a snowball approach. The objective was also to arouse the interest of decision makers and public funders. It was also important to have user representatives like Association of Former Children in Child Protection Care and Family Association. The seminar took place 2 months ago at the end of March. Now, Maud complete my speech.
So today we wanted to share some of the key points that emerged from the exchanges we had during this today's seminar. So I just put on the slide some of the principal reflections, and you will hear that some of these reflections are really linked to Tanya's presentation. So we first discussed the obstacles related to the definition of concept. We talked about that yesterday. Child maltreatment is not one concept, but several, and some of them are much more difficult to define. It is, for example, the case for neglect and also emotional violence. And we also discussed how to deal with the co-occurrence of this violence. It was especially highlighted that participatory approaches, research could help in finding the best possible definitions, and the expectation of the audience was to have a shared work to make these definitions operational, to make some studies and epidemiological survey. It was expressed by the audience. So concerning the research team, well, sorry, that was not. It's for the research team, it's important to have a good comprehension of the organization of our child protection services. Or you saw in Tanya's presentation that is really complex. It's really complex because some studies could concern children taken charge by these services, but also because differences of organization can have an impact on how the data are coded, even for hospital data. And in France, child protection is managed by the county councils, so at a departmental level, and it has a great impact on how are collected the data. So it may seem obvious, but in French, child protection and public health are long-lived in two different worlds. So it's just starting to change. It's necessary to have an intersectorial approach, but it's quite difficult to put it into practice. So to mobilize existing data, there are some regulatory and challenges, and we will see it in the next slide, but also technological challenges. So we have obstacles related to disparate software systems, which make it difficult to collect data on child maltreatment. And this problematic is also linked to the departmental organization. Each department has its own technological choices. We also discussed the potential of other data sources for surveillance to develop a surveillance system that could be explored, such as data from legal medical institute, data from the good name is the Child Protection and Prevention Units, that was mentioned before, but also the administrative database like hospitals data. We also discussed the huge interest of including adverse childhood experiences and especially child maltreatment more systematically in health surveys as an health determinant. But this also requires to build shared question module. So all of these questions, in fact, and difficulties are traditional for any epidemiological study, but they are exacerbated when working on maltreatment, child maltreatment. Also, a common problem concerns the funding of the studies. Researchers has highlighted the fact that investing in statistical data on child maltreatment is important to support the strategy of preventing child maltreatment. So taking these benefits and comparing them to the estimated cost of maltreatment, it's a really good investment. Unfortunately, during the seminar, we discussed about how it's difficult for researchers to securing the funding from the institution, also because except from the National Child Protection Observatory, there is no specific call for project. One of the solutions suggested during the seminar is to setting up networks with several research teams, like the University Hospital Federation CHILD that Martin Chalumeau presented yesterday. So concerning child maltreatment, we also have specific questions linked to the subject. Some of the participants ask for a professionalization of children at risk in the health field in terms of identification, reporting, caring, and also it's necessary to develop more studies. So during the second day, we discussed more specifically the regulatory and ethical considerations. We talked about it a little yesterday. So these issues involve the Commission nationale de l'informatique et des libertés, which is the French institution dedicated to the protection of personal data in the framework of the General Data Protection Regulation. So we had a representative of the CNIL who spoke at this seminar. It also involved the research ethics committees, and we had an intervention of the president of the INSERM Ethics Evaluation Committee. So the discussion focused around three main topics. So the first one was the applicable rules in terms of data protection. In France, they are designed for the general population, so information and parental consent is required to include children in studies, even if exemptions can be done for children over 15. But it's a real difficulty on children inclusion process. There are some exemptions rules, but they are not specific to child maltreatment and may not be relevant. The second point was the cross-referencing data from different institutions. So in addition to the technical difficulties of linking the various databases, there can be some legal difficulties, particularly to access to justice data, but also some resistance to share these databases linked to the fact that we are really working on different professionals' world, and for example, data protection officers were the person in charge to control the compliance with data protection regulations of the different institutions are not necessarily familiar with the subject and may object to the implementation of studies. The third point was about how to manage when there is disclosure of child abuse in a study. If this does not appear to be a difficulty for the practitioner of the field of protection services, it may appear to be a huge obstacle for research teams. So some rules of good practice exist, and starting by working with professionals from the field right from the beginning of the project. I know it can sound like pushing an open door. I don't know if we can say that, but it's still important to remind it. And we also have international guidelines that were mentioned during these 2 days on which to build. So from the International Society for Prevention of Child Abuse and Neglect, from the World Health Organization, the INSPIRE strategy, and also from the US CDC. So one of the conclusions was maybe we need to promote this recommendation and work to adapt them to the French regulatory context. It was also suggested to make advocacy, to simplify the reglementation, to make it easier to set up studies. So I don't put it on the slide, but some of the participants asked to develop pluridisciplinary, dedicated research team on child abuse and neglect. And to conclude our presentation, what are our perspectives as a public health agency? So to start, we decided to make a valorization of this seminar. We have today presentation indeed, but we plan presentation at the next ISPCAN Congress. And we are going to publish the seminar proceeding with access to the presentation online, and we hope that we can translate it in English also. So what you have to know, it's that traditionally intentional violence is not in our perimeter of work at Santé Publique France. So we are depending of the Ministry of Health, and child maltreatment issues depend on the social ministries. But this is moving, in particular, thanks to a governmental program that is centered on the 1,000 days period, so from pregnancy until the entry to preschool. And that really helps us, the different institutions, to work together. So we want, as an institution, to take this opportunity to propose a coordinated approach. So this seminar was for us a starting point to develop this strategy, so in both surveillance, but also in the prevention of child maltreatment. So our next step is to work on a roadmap to have milestones to develop epidemiological surveillance, and we also have to develop what are the implications for prevention policies. So we are not starting from nothing. As Linda told you, in our unit, we work on pregnancy and early childhood and how to develop and support a nurturing care environment and responsive caregiving. We based our strategy on the World Health Organization recommendation from the nurturing care framework for early childhood development, which are really consistent with the child maltreatment prevention international guidelines. But we still need to go further, also to advocate that child maltreatment is a major public health issue. So to finish, it was for me the opportunity to thank our scientific organization committee, and you can see who was there, and all the speakers of this today, and all the participants. So I finished. So thank you for listening to us. Thank you to the organizer for inviting us to these two stimulating days. And if you have any questions, we will try to answer it the best as we can. But
thank you very much, Maud and Linda. Questions? John, you're a long way away.
Thierry, n'hésite pas à te rapprocher si on a...
Thank you very much. Do you have data sharing legislation in France that allows government departments to share data? Is my question clear? So, can Treasury talk to health, talk to... They must...
No, that's not so simple in
so
France.
you have no intergovernmental data sharing legislation?
No.
That's going to make it very hard, yeah.
Yeah.
And I guess my second point is I really like your idea of, I think Sharon was talking about policy windows opening and the 1,000 days thing.
Yes.
Maybe one of those windows. It's become very important in Australia to understand that first 1,000 days from the multiple perspectives of mother, child, family, neighbourhood. And maybe that's a way to, fingers crossed.
Yes, for us it was really an opportunity, and also to work in share with other ministries, which is quite difficult. I'm not sure it's a French problem. I think you all share this problem, but this governmental project was really an opportunity to discuss all together, and we tried to take this opportunity to put the maltreatment, child maltreatment subject in it.
Maybe we can have it. You're totally right, because we try to emphasize the life course approach, epidemiology life course approach, with the consequences of adverse childhood experiences. So with that solid scientific basis, we have more evidence for advocacy and make people working more together. So that's the, as you say, hoping.
Thank you very much for your presentation, and I think it's good for researchers to hear. I think, we analyze, we collect data, we analyze it, we write papers and recommendations in them on how surveillance systems should change or how policies should change. I think it's good also to hear sometimes that it's not always so easy, even when you try to implement things for many, many reasons. And I was wondering if you could, I don't know if it's politically correct, but if you could say what are the main obstacles, in your view, to having this surveillance system of child maltreatment? We talked about different types of measures yesterday. It's not so simple to have good measures. There are different sources of information, but what do you think are the biggest challenges, actually? Is it money, political will? Are the data not existent? I don't know, just if you have an answer to that.
I think the main difficulty is we have to share a common culture, and for now, the work, the research is on child abuse and neglect is more on the. We don't have so much research on it because it's much more on the social work that is developed, and in France, social work it's not something that you find at the university. So it's not. How can I say that? I will ask Thierry to say it for me. It will be shorter. Le travail social est pas nourri par la recherche.
Yeah, there is probably a lack between the daily work of social workers and this culture of collecting data for the research and the link with universities and research teams. So we have to sustain this and to encourage the thing. So that kind of seminar is just like maybe the opportunity to highlight this lack of more intimacy, I would say, between these different worlds. Sorry. So it may be a possibility.
Yeah, I just wanted to add some comments from a Swedish perspective, where we have been trying to deal with this epidemiological challenges for some time, and I imagine that you may have seen the work that done by Ruth Gilbert in London and her group, that was published in Lancet quite a few years back, that gave some guidelines about, or ideas about how you can deal with this epidemiologically. But because there are some challenges. I think, for example, if you have a surveillance system based on reports from hospitals or social workers, and start working with the issue, in many places what you see is an increase in cases, because there is such a big, what we see in hospitals and in the, it's just one piece. So if you really want to know, there is, you have to ask the children, and furthermore, we know from research now that neglect is probably more detrimental in the long term than physical violence itself, although they're often connected. And to get data on neglect, it's really difficult because children don't realize that themselves. So the way of that has been successful in trying to estimate that is interviewing young adults who have some perspective on their own childhood. That was just my comment. Yeah. And there, in Sweden, we've had these with 5-year intervals, led by one of our colleagues, Staffan Jansson in Karlstad. Yeah.
I don't know if you have a comment to that, but
No, but really
very useful. Stefan, who he mentions, Stefan Jansson. Jensen? Yeah, Jensen. He has. He would be an interesting contact. I'm sure that I think he's in IPSCAN. I can never say it. IPSCAN. So, okay.
Okay, thank you.
Thank you very much.
Thank you.
Thank you.
Thank you.
Et bonne chance.
Merci.